Well, good afternoon, everybody, and thank you for joining today's briefing. As of today, we have had 1,273,623 COVID cases, 6,290 new cases reported since yesterday, 3,815 people in the hospital, and 15,004 people who've died. Sadly, most all of the COVID deaths that are now occurring are preventable with a safe, easy, free vaccine. And I want to thank the millions of North Carolinians who've stepped up to get one. But we need more people to get vaccinated. How many more people have to get sick and die because people don't get this miraculous, God-given, effective, and extraordinarily safe vaccine? How many more people will have to witness the painful, cruel death of a loved one to finally see that vaccines are the way out of this? Today, Dr. Mandy Cohen, our Secretary of the North Carolina Department of Health and Human Service, will walk through the data to show our statewide COVID trends. The numbers aren't good, especially the number of people in the hospital and dying. We can't stress enough. By far, the most people hospitalized by COVID right now are unvaccinated. For the most part, ending up in the hospital because of COVID is largely preventable. COVID-19 vaccines are continuing to do their job by stopping most of the severe illness and death among those who've had their shots, and they remain our best tool to end this pandemic. And remember, these safe and effective vaccines are available all across our state regardless of whether you have health insurance. They are absolutely free. If you're still unsure about getting one, how about get off social media and get on the phone with your doctor? That's the best place for accurate medical information. While vaccines are the best protection from COVID-19, effective treatment is also available if you do get infected. If you test positive and have mild to moderate symptoms, I encourage you to talk with your doctor about the treatment of monoclonal antibodies. They've been shown to be effective at preventing hospitalization and severe illness once you already have COVID. This shows how important it is to get a COVID test, because this treatment has to be administered within 10 days from the start of symptoms. And of course, your doctor will make the final decision on whether monoclonal antibody treatment is right for you. Last week, I signed an executive order to make it easier to get monoclonal antibody treatment by increasing the number of places that you can get it around the state. North Carolina is also working with FEMA to set up several sites where this treatment will be administered. We hope that by preventing COVID-positive patients from developing more severe illness, we could save lives and take some of the strain off our hospitals. Now, I'd like to ask Dr. Cohen to present our data and to provide other updates. Dr. Cohen.
Thank you, Governor. Before we jump into the data, I want